this video today, we're going to talk about why accelerated TMS is not saintly, but really why it may not matter for you. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients know their options for pain relief, whether it's physical pain or whether it's mental pain. And what we want you to be able to do is to lead a life that you deserve. And by doing so, you're able to do the things that you want. Today, we're talking about a treatment specifically for depression that has been in the news for a number of years now. And that's the Saint protocol for doing TMS, which is completely different than the standard protocol. In essence, with a short kind of like preview, it's a treatment that does a number of treatments in a short time frame. Traditionally, TMS is done for anywhere from 30 to 36 sessions, and that's over the course of, give or take, about 4 to 6 weeks. The Saint protocol is normally done within the context of 5 days. And so why is that better? Because the remission rates, meaning the amount of improvement that patients have been able to have, has been significant in nature and has been better than even what traditional TMS has seen. So we're going to kind of go through 2 papers real quick and then kind of compare and contrast accelerated versus Saint. So this is the original article that looked at Saint, and it stands for an acronym, as I'm sure you were able to kind of surmise, that stands for Stanford Accelerated Intelligent Neuromodulation Therapy. And it's specifically for treatment-resistant depression, so the worst of the worst depression. It was formulated by Nolan Williams, who's from Stanford, who was able to say, let's do some things a little bit differently for a better outcome. When we look at the patients that were included in it, it was patients that were on average around 44 years of age. They had an onset of depression in their early 20s, a duration of depression that was going on for 22 years at least, and they had a number of different attempts at being able to try and treat their depression, anywhere from 5 to a number of different types of trials lifetime, and they've had trials of medication, and they've had a severity of disease that has been significant. When they look at what was the results, what they found of the 21 patients that actually were participants in the study, they were able to follow 19. One withdrew, and it was a sample that was able to show that they were able to improve overall depression by 90%. Which is a significant number. And when they look at the intent to treat analysis, that 86.4% met remission criteria. And so at the end of the day, this treatment, which was an accelerated high dose protocol with functional MRI guidance, was able to be safe, well tolerated, and effective. And they did it with the most rigorous of studies by doing a double-blind sham control trial. So this picture represents what they published in the paper that looked at how they were able to isolate the site for each person. And at the end of the day, what they're looking at is, can we use functional MRI to determine our location so we get a better response? And this is the differentiator between Saint versus accelerated TMS. So what they were able to do was to use this type of modality that looked at a method of identifying it by a type of diagnostic tool that's not present everywhere. It's not a traditional MRI. It's a functional MRI that is normally associated with an academic center. So accordingly, you can't be able to do this at your average run-of-the-mill clinic. It has to be a place that has access to it in order to be able to get this specific understanding of what's going on with that person. So this is their protocol. When they look at it in depth, what they were basically doing was doing a number of sessions per day. And so at the end of the day, what they were getting was somewhere an average around 10 sessions per day. And they were doing this over a course of 5 days. You can see the green are the actual sessions and the white are the time frames in between where they had time to be able to kind of space it out. But it was a long day for the patient, but it was able to provide depression relief that took place in a week as opposed to 6 weeks, and gave an outstanding better result. This graph looks at how long was it able to last in a sustainable treatment that gave people relief for a number of weeks longer than what was actually expected. And the conclusion from this particular paper was that it was safe, it was feasible, and it had a high rate of remission, meaning improvement. And it was done with a fairly rigorous type of research study, meaning a double-blind sham control. And they stated that potentially the way to be able to assess this further was to do a larger study. And Subsequently, they did another study that was called SNT, which is Stanford Neuromodulation Therapy, which is a double-blind randomized controlled trial. And basically what they comment on is how frequently depression is. And in essence, what they wanted to do was to say, okay, previously we've seen treatment-resistant depression was treated, but it was a 6-week duration of their observation. And so what they're able to do is to do that same protocol and then be able to evaluate what happened. Same functional MRI with an assessment of how well it improved things, specifically the MADRS score, which again is that Montgomery-Asberg depression rating scale, as opposed to a traditional PHQ-9 that was able to assess how well patients did. And what they saw is that patients still had that large antidepressant effect, that after 5 days of treatment, 79% of patients had improvement and had remission. And that was compared with previously 13% in the sham treatment. So they could tell that there was a difference between the two. And that was definitely able to assert that this could be an incredible utility in emergency or inpatient therapies, which is exactly what they're doing right now. They're looking at how can this be useful within that construct of saying, can we be able to get insurance approval for someone who has potential severe depression that may result in a bad outcome? Can we be able to place them within the aspect of the hospital and get a good result? And so at the end of the day, the utilization of treatments like Saint or SNT have been able to really kind of come into their own with the aspect of treating patients. But as of late, we've talked about different offerings from traditional clinics that have looked at doing accelerated TMS, which is a number of sessions, but without the functional MRI. What we don't know, because there's not enough research, is does this really make an impact? We postulate that that might be the case, but we don't know it definitively as of yet. So from a patient standpoint, is this something that you may want to consider? Potentially, because as we saw with a certain number of sessions, there does need to be a spacing, but we may be able to impact patients by doing more sessions at a time than just doing one session per day in order to get a potential response. Hopefully this was something that you found interesting. If you did, please hit the like button. And if you want to learn more about topics like this, hit the subscribe button so we can tell you your options for dealing with pain, whether it's physical or whether it's mental, and how to be able to punch pain in the face and get back to leading the life you deserve. Thank you so much and have a great day.